Okay, so if you've ever had that really bad low back pain, you've probably heard the diagnosis slip disc or herniated disc, right? For decades, that's been the main suspect. But what if that's not the whole story? What if for most people, the real problem isn't the disc at all? Let's dig into what the science is now telling us.
First off, to really get why this is such a big deal, you have to understand the sheer scale of the problem. Just look at this number, 80%. Yup, a staggering 4 out of every 5 of us will have to deal with low back pain at some point. It's one of the most common musculoskeletal issues in the world and a huge reason for disability. So figuring out where the pain really comes from, that's not just an academic exercise. For a lot of us, it's personal.
So, for years, where did we think all of this pain was coming from? Let's take a look at the theory that's been front and center for a long, long time. This is the classic model, and it's called discogenic pain. The idea is pretty straightforward. You've got these discs, they're like little jelly-filled shock absorbers between your spinal bones, and as they wear down, they can tear, and those tears can then irritate nearby nerves, which sends those nasty pain signals up to your brain. It kind of makes sense, right? Damage the cushion, you get pain.
And here's the thing, this theory isn't totally wrong. It's just incomplete. Research shows that about 40% of chronic low back pain does come from the discs. Now, 40% is a pretty big chunk for sure, but it also immediately makes you ask a very important question. Exactly, what is going on with the majority of people, the other 60%? If it's not the disc, then what is it? And this is where the whole story takes a really fascinating turn, forcing researchers to start looking for clues in a totally different spot. And that new spot? It wasn't in this soft, squishy disc. It was in the hard tissue right next door, the bone itself. You know, radiologists started seeing these really specific patterns on MRIs in the vertebrae of people with back pain. They gave them a name, Modic changes, or MCs for short. Now, these aren't problems with the disc. They are changes happening inside the bone marrow of the vertebra, signs of inflammation, swelling, and just general distress in the bone. Now, there are a couple of types, but let's focus on these two. On the left, you've got Modic type 1. It shows up bright on an MRI, and that tells us there's active, painful inflammation going on. You can think of it like a hot spot inside the bone. On the right, type 2 is more of a chronic thing, where that inflamed area has been replaced by fat. But the key thing to remember is type 1. That's an active, angry, inflammatory process, and it turns out it's very, very strongly linked to pain. So where do these changes usually show up? Well, it's no coincidence. The data clearly shows they're packed into the L4/L5 and L5/S1 levels. That's the very base of your spine. And that's the part of your back that takes the most mechanical stress, day in and day out, from walking, lifting, even just sitting at a desk. So finding these Modic changes was a total game changer. It basically gave birth to a whole new theory of where chronic low back pain actually comes from. And this is the fundamental shift in thinking. On the left, you've got the old idea, discogenic pain, coming from the disc. But on the right, we have the new model, vertebrogenic pain, which literally means starting in the vertebra. And in this model, the pain isn't from the disc. It's from nerve endings inside the bone itself, getting all fired up by that inflammation we saw in the Modic changes. So here's kind of how it all goes down. First, the end plates. That's the surface where the bone meets the disc. They get damaged from all that stress. That damage kicks off inflammation inside the bone, creating those Modic type 1 changes. Then, the body actually grows new, super sensitive nerve endings into that inflamed bone. And finally, there's a specific nerve, called the basivertebral nerve, that picks up those distress signals and sends them to the brain. And that is what we feel as pain. Okay, so this is all really cool biology, but what does it actually mean for people who are living with back pain every day? Why is this so important? It's important because the connection between these bone changes and actual real-world pain is incredibly strong. Just look at this number, 66%. That's how many patients who had these bone marrow changes on their MRI also said they had low back pain. This isn't just some random correlation. It's a powerful signal that these changes are a major source of the pain people are feeling.
And when we dig into the data, we find some other interesting things. Among people who have these modic changes, women seem to report pain at a much higher rate than men. We're talking 72% versus 58%. Now, scientists are still figuring out exactly why, but it might have to do with things like hormones or bone density or maybe even body mechanics.
But here's what might be the most surprising finding of all. It has to do with age. You might just assume that this is an issue for older people, as their spines get more wear and tear. But the data tells a very different story.
This is just incredible. This chart looks specifically at people with that active inflammatory modic type 1 change. For the elderly group, the link to pain is huge, over 90%. No surprise there. But look at the younger group, people 44 and under. The rate is almost exactly the same. This tells us something huge. When you have this specific kind of inflammation inside the bone, your age just doesn't matter. It's a massive pain generator.
And this is where all the science turns into real hope for patients. Because if we can pinpoint the exact nerve causing the pain, we can develop super targeted treatments. Doctors can now use an MRI to confirm that the pain is in fact vertebrogenic. And from there, there's a really promising procedure called basivertebral nerve ablation. It uses radiofrequency energy to basically just turn off the pain signal from that one overactive nerve. It gives people a path to relief without having to go through major spinal surgery.
So the big takeaway here is this. For a huge number of people, the real source of their chronic back pain isn't the disc, it's the bone. And this shift in understanding is already opening up brand new doors for better diagnoses and more precise treatments. Which leaves us with a really exciting question. Now that we're finally looking in the right place, could we be on the verge of finally getting a handle on one of humanity's oldest and most common problems,